recently, the last sort of 18 months, we've seen a huge rise in nicotine pouches that we're finding in schools, and that particularly teenagers and boys are using. And at the moment they can be given, sold, marketed to children, which we just find extraordinary until the new tobacco and vape bill comes in. So do you just want to sort of maybe just talk us through what these things look like, for parents and professionals to look out for?
So this is an example of some of the nicotine pods that we find that come into the lab here. This particular type of nicotine pod has a very high nicotine content of
50 milligrams. So if we think an average cigarette has 12 milligrams, but you actually breathe in about 2 milligrams, that's 50 milligrams per pouch. I mean, that's unbelievably strong, isn't it? That's like sticking 10 cigarettes here.
Yeah, exactly.
Under your gum.
So they'll put it up under their gum and between their lip and their mouth, and that will just sit there throughout the day. And not only is that a really high amount of nicotine, it's also really dangerous for their gums. And so these pose quite a lot of danger, and we're seeing they're growing in popularity.
And we've also seen challenges on like TikTok and Instagram of how many pouches you can cram in your mouth and things like that, almost as though it's something quite funny, and that I don't think there's really an understanding of the high nicotine levels in these products, and you just have to read the packaging carefully, don't you?
Yeah, exactly. Definitely could be dangerous for children.
And even for adults too, not just for children. If we're talking, 20 milligrams, 30 milligrams, up to 50 milligrams, there's no legal maximum because they contain synthetic nicotine, so they don't fall under the regulation. So the reason why they're not regulated is because at the moment, although it will change with the tobacco and vape bill, is because they contain synthetic nicotine, which of course is very powerful and very strong. Okay. I think that's probably all we need to say.
Guys, my name is Dr. Patrick Saraby. I'm working in Bupa in Westbourne, and I'm here to talk to you today about nicotine pouches and their effects on the mouth. So I did a 2-year study on nicotine pouches at university. I moved here to work, and in the last 12 months I've been quite concerned because I've seen a lot of cases of young men coming in with problems in their gums due to the overuse of these nicotine pouches. So my first concern is that these nicotine pouches can cause what we call localized gum recession. The problem with gum recession is that you can't just grow gum back without doing a surgery. So when gum is gone, it's gone. Another thing that I wanted to point out is that the nicotine pouches cause dry mouth, which is a big problem because dry mouth leads to bacteria proliferating more, which means you can easily gain more cavities in your teeth. So it's really important to consider that this is a new product and the long-term effects of the product have not been fully researched. So we must be very careful when starting to take these sorts of products. Please think carefully before buying these nicotine pouches in the shops, because the risks are not explained on the boxes. The stronger the milligrams on the box, the more dangerous to the gums.